Good, happy Friday afternoon, November 20, 2020. I'm Riley King, and welcome to this Friday afternoon edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday afternoon, so let's begin. First up, we're going to begin with your COVID-19 updates, coronavirus in New Hampshire, key information and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 16,277 number of people in New Hampshire have tested positive for COVID-19. 11,674,074 number of people in the United States have tested positive. 506 number of deaths from COVID-19 in New Hampshire. 826 number of people have been hospitalized with COVID-19 in New Hampshire. And 251,970 number of deaths from COVID-19 in the United States. And now let's take a look at this map of New Hampshire where current cases of COVID-19 are. Manchester, 507. And let's take a look at this map of New Hampshire where total cases of COVID-19 are. Manchester, 37. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple. Daily new positive COVID-19 cases. In the orange, new hospitalization. In red, deaths. Let's take a look at this chart here. Current cases in the purple. Total current COVID-19 cases. And in the orange, current hospitalization. And let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases. In the orange, total hospitalization. Red, deaths, and blue, recovered. Let's take a look at this chart here. Positive PCR test rate and daily PCR test. Let's take a look at this chart here. Age group of cases, female and male of cases, and risk information. Let's take a look at this chart here. Infections, hospitalizations, and deaths. Let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. Let's take a look at this chart here. Your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Sununu issues a statewide mask mandate in effort to slow the spread of COVID-19. The mandate starts today. Applies to indoor spaces, outdoor, where distancing can't be maintained. Let's take a listen to that video from WMUR News 9, Adam Sexton.
Improvement season is taking off at Beltate's Building Supply. From building materials to tools, paints, and everything else you need, we'll make fall home improvements a breeze. Shop online at beltates.com. Visit one of our 9 locations or place your order via phone or email.
Driven by data and the threat of a virus that's spreading through every county, Governor Chris Sununu is mandating masks across New Hampshire.
It works. The data shows that. It has been proven. The social distancing, incredibly important as well. But today we're really elevating that message even further given the seriousness of the current crisis.
Effective tomorrow, it'll require everyone over the age of 5 to wear a mask in public places, indoors or out, where social distancing isn't possible. The governor says the numbers show this move is needed now, with a 100% increase in the 2-week hospitalization rate, outbreaks in long-term care facilities, and a 4.1% test positivity rate.
Our numbers have been consistently rising, maybe not as fast as other states, but they are rising, and that right now there's no sign that they're going down.
As for enforcement,
education is the best tool that we have in that, and that's really what we're going to be relying on.
With hospitalizations doubling and facilities facing a staffing crunch, Sununu hopes this can alleviate that strain, as well as keep people safe and the economy open.
The data is clear. If folks don't want to look at the data, I can't force them to listen to reason, but it is clear. It isn't speculation. It isn't conjecture. It isn't a hoax. This is so real, and it is skyrocketing all across the country.
The mask mandate officially goes into effect in about 2 hours, just after midnight, and will last at least through January 15th. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. Tilton Veterans Home reports COVID-19 outbreak. 21 staff, 23 residents test positive. 3 residents have died. Let's take a listen to that video from WMUR News 9, Siobhan Lopez.
Because Pono North has the largest selection of used vehicles in New Hampshire. Over 1,300 vehicles.
Well, Mike, officials at the Veterans Home say back in March when this all began, they knew it wasn't a matter of if, but when this virus would find its way inside. Unfortunately, they noticed a group of residents with symptoms back on November 10th. Since then, there has been testing, and they placed residents who tested positive in a quarantine unit. In just 9 days, they say they have had 23 residents and 21 staff members diagnosed with COVID-19. 3 residents have since died, the latest passing away this morning. The Commandant says it is heartbreaking and just an example of how community transmission eventually makes its way into facilities like theirs.
Our staff live in the community. Their children go to the schools, and they're shopping and doing all the things, and we're all being as safe as possible, washing our hands, wearing our masks. But this is a very nefarious virus that, just spreads. It's so contagious. I can't even explain how heart-wrenching it is, because I know how my staff feel about having brought it in.
And with so many staff members in quarantine right now, they are desperate for help. With the support of the congressional delegation and the governor's office, they have put in a request with FEMA for additional staffing. Reporting live, Siobhan Lopez, WMUR News 9.
Okay, and there you go on that video and that report. More New Hampshire schools switch to remote learning. Rising community COVID-19 infections, positive cases in schools lead to changes. Let's take a listen to that video from WMUR News 9.
The Merrimack School District is moving to remote learning the Monday after Thanksgiving. The school board voted for the move yesterday. Students will learn remotely until the day after Martin Luther King weekend in January. Administrators made the recommendation due to the rising cases in that community there.
All Runlet Middle School students in Concord will learn online today after a staff member at that school tested positive for the coronavirus. Remote learning will take place online next Monday and Tuesday as well. The announcement comes after the superintendent announced that both the middle school and the high school will move to remote learning after the Thanksgiving break until January 19th. While elementary schools will remain in the hybrid model until December 22nd. Starting January 4th, all Concord schools will pivot to remote learning.
New Hampton's community school will also switch to remote learning after a staff member tested positive for COVID-19. Yesterday was the last day of in-person learning for students there. Students are expected to return back to school physically on December 7th.
Okay, and there you go on that video and that report. People step up to help others as Thanksgiving approaches. In the face of the pandemic, giving back to communities around them. Let's take a listen to that video from WMUR News 9, Andy Hirschberger.
For 6 years, Will Georges of Georges Heating and Cooling has given free turkeys to Manchester families in need. Despite the pandemic, they were able to distribute 100 frozen birds for Thanksgiving meals. Georges is a first-generation American who once was on the other end of these types of efforts.
I've needed help in the past growing up in communities like this one right here. And so being able to give back, I think it's the right thing to do.
Georges says people are hurting from losing a job to even a loved one, and this could make the holidays a little easier. There are acts of Thanksgiving kindness, large and small, everywhere during this pandemic. Some people don't have much to give, but they give just the same. Kathy Francoeur of Ma's Cafe and Tavern in Deerfield will be giving away drive-through turkey dinners on Thanksgiving Day.
We're all struggling, we're all hurting, and I didn't know what I could do. I don't have a lot of money. Business is down probably 50-60% right now, but I can cook.
Francoeur has never done anything like this before, but when her first restaurant burned down a few years ago, people rallied to help her.
You know, I have a family too, and we're all struggling. You gotta do something. There's gotta be some good somewhere.
Francoeur says she hopes to reach a lot of senior citizens who may be feeling isolated, but all are welcome. Andy Hirschberger, WMUR News 9.
Okay, and there you go on that video and that report. Excellent stories there. Woman who says she was never sick in her life has medical problems post-coronavirus infection. Let's take a listen to that video from WBAL TV 11 News, Baltimore.
Make the decision to be there for the veterans in your life. Learn more at BeThereForVeterans.com.
I was just having sweats and a cough, a little sore throat.
Back in April, 76-year-old Hattie Mae Ross went to the emergency department. She was sent home and recovered from COVID in 2 weeks. A few months later, she was back in the hospital for a week, this time with heart problems.
Which we think is likely related to the COVID infection that she had had some months before.
Cardiologist Dr. Athol Morgan says Ross was healthy prior to COVID.
We believe that the coronavirus in some people directly attacks the heart and causes heart damage, which is what we think happened with her.
Now Ross wears this device to monitor her heart, and she is on 3 different medications. She says this is the first time she's taken anything other than vitamins.
I never had high blood pressure, low blood pressure, nothing. My doctor told me that I was the healthiest patient that he had.
Ross says she misses her walks through the neighborhood and bowling, but she says she's working her way back up to it and doing much better. She offers this advice.
When you find something totally different going on in your body, go to the emergency room or to a doctor right away, because you never know. Because just like me, I didn't have what you call a lot of symptoms, but it was there.
Mrs. Ross telling it like it is, and we wish her the best. One other note, Dr. Morgan says that they have a lot of heart patients who are not coming to the doctor or the hospital when they have symptoms because they're afraid of getting COVID. And he says those people as well need to make sure that they listen to their bodies and they get the treatment they need. Reporting live in Northwest Baltimore, Lisa Robinson, WBAL TV 11 News.
Okay, and there you go on that video and that report. Rawson reports tips to stay safe during Thanksgiving. Let's take a listen to that video from Jeff Rawson right now.
Hi, we all want to have a normal Thanksgiving this year. Of course, we want to see our families. We want to sit around the dinner table together, catch up, even argue. I miss that. I even miss arguing with my family. The CDC and public health officials are saying you probably shouldn't do the holidays like you normally would this year. But I want to show you some startling numbers. Even with all the guidance out there, Ohio State University's Wexner Medical Center did a study and found this. 38% of you plan to gather in groups of 10 or more people for Thanksgiving. 33% of you say you won't require masks, and 25% say you won't socially distance, and you won't make your guests socially distance. So what if you want to have a Thanksgiving gathering, tamped down, but still a bit of a gathering, and you want to do it the safest possible way? Well, we're about to show you. Turkey's in the oven, you're getting all set, but here's the question. Who can you invite this year? Can you invite the friends down the street who you've been seeing on and off during the pandemic? What about your cousins a few states away who you haven't seen? We're asking Dr. Robert Glatter of Northwell Health.
You should really have just your immediate family, people you live with, your household. And that makes it much, much safer.
Okay, got it. By the way, how good does this turkey look? But what if your immediate family is your son or daughter who's in college, who needs to come down, who's sort of been out in the environment, but they are part of your immediate family? Should they quarantine for a certain number of days? Should they get a COVID test before they come? What's the best way to work that, Doctor?
If you want to have a traditional Thanksgiving, you have to start a quarantine 14 days in advance. And that means that people that will come in cannot be engaging in activities with groups of people. They need to stay amongst themselves. And that also means really just doing low-risk activities, wearing a mask. If you're going to do this, you need to have a COVID test at least a day before you leave to travel, whether it's by bus or airplane, for any long distance.
The next big question, where to eat the Thanksgiving meal? I mean, where physically to eat it? Normally, of course, you do it here in the dining room, and you could separate your chairs out 6 feet apart. But we do know what experts say. They say outside is always best for COVID because inside the particles can fly around. Outside it has more room to get away from you. So in these cold temperatures, do you put on your coat? Do you come to your outside table and dress this up out here? Is that what's best?
Obviously, weather permitting, the best is to do it outdoors. That's really the safest. In this way, the virus gets diluted. If you will do it indoors and absolutely have to because of the weather, you need to stay at least 6 feet apart. Ideally, if you're bringing in people from out of state, people that don't live in your household. And wearing a mask when you're not eating is really the safest.
What about how to serve the food this year? I mean, normally the best part of Thanksgiving, right? You're passing the turkey around, everyone's touching the cranberry sauce dish like this, or the mashed potatoes, everyone's touching it. You're gonna be like, give me your plate, take some more mashed potatoes. But this year, you probably don't want that, right? You don't want people touching everything you're touching near your food. So do you stick with this in some other way, or do you do it like buffet style, where the food is somewhere else and everyone serves themselves?
You should do it this way. Use a serving aisle and have the dishes at least 5 or 6 feet apart, and then have people go separately and not wait in line. Because that's really the risk when people are standing close together.
When it comes to serving food, the CDC is recommending everyone bring their own utensils, forks, knives, cups, dishes, whatever you're going to use if you're going over somebody else's house. Our experts say there's another option too. You don't want to bring your own stuff. Make sure the homeowner where you're going washes everything in the dishwasher on high heat to kill off any germs or bacteria on the surfaces before you use it. We hope you have a healthy and safe Thanksgiving. We'll argue with our families next year. Back to you.
Okay, and there you go. Good tips there from Jeff Rossen. And that does it for this afternoon edition of the Riley King Newscast, right here on the Riley King Network. Thank you for joining us for this afternoon edition. Have a great rest of your afternoon, everyone. I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.